So now that we looked at the sources of the funds, the revenue, when it comes to pharmaceuticals, let's now look at where it goes. All right, so who gets it? When we look here, it's kind of a flow chart when it comes to pharmaceuticals. So, this is, the top is where the pharmaceuticals are made, the bottom is the patients. And what happens is they go down this way, and the money tends to flow up this way. All right. So let's kind of break that down step by step. So first, the retail pharmacies. That's what, for the most part, patients see. When they get a prescription filled, they go to a retail pharmacy. There's about 55,000 local pharmacies nationwide, but more than half of these are in the larger chains. So that's going to be your CVS, your Rite Aids, Walgreens, Wegmans Pharmacy, Target Pharmacy? No, Target Pharmacy. Walmart, Sam's Club pharmacies, BJ's pharmacies. So a lot of places have pharmacies. These are in chains. But you also have the local, small, family-owned ones. Now, what has become more popular, and especially for people who tend to have more regular medication, is mail order. And either mail order call-in or mail order through the internet. And this has become much more popular as well. And makes up about 15% of all prescriptions getting filled. So the retail pharmacies, they get it from the wholesalers. We'll talk about them in a second. And if you've ever been to a pharmacy and actually seen kind of the part of the store where they have the actual medication, you see it's not a big area. And if you think about it, especially the Rite Aids, the Walgreens, the CVS's, they have a lot of people coming in. So you might think, well, wait a second, how do they have so many people coming in getting medication yet they have such a small place to store it? The way that they do that is they keep small amounts on hand, okay, depending on the medication, how often it gets filled. So they keep small amounts on hand. And what they do is they do very regularly, daily or weekly, orders to these wholesaler companies. And so whenever they notice they're getting low, they put an order in, the wholesalers bring out the small amounts, so that way they don't have to store it all there. There's a lot of competition in the pharmacy market, and so a lot of pharmacies don't have market power, and so it's a pretty competitive market. So the profits aren't huge in these pharmacies, at least not as big as they are in other parts of medicine, where the profit margins can be very high. All right, so that's the retail pharmacies. Next one is the wholesalers. It's really three companies that account for a bulk of the wholesale business of pharmaceuticals in the country. The job of these wholesalers is limited to storage, warehouse, and distribution. So, because moving drugs around the country is fairly cheap, only a small amount of the money, the revenue from pharmaceuticals actually goes towards these wholesalers. So they get it from the pharmaceutical companies, and they store them and then send them out. The insurance companies and the PBMs, which again stands for the pharmacy benefit managers, that's the financial side of the pharmaceutical market. The pharmacy benefit managers, they get fees from the insurance companies, but they also get money as far as they also get from negotiating prices. They get extra money through there as well. It's a little bit difficult to measure who gets what in this process, the insurance companies versus the pharmacy benefit managers, because of the complexity of the payments. But in general, this is the financial side. All right, the pharmaceutical firms. The pharmaceutical firms, that's where most of the revenue goes. All right, most of the revenue for pharmaceuticals goes to the pharmaceutical companies. The largest companies are going to be your Merck, Johnson & Johnson, Pfizer, GlaxoSmithKline, These four total about $30 billion in sales. Now, the top 10 pharmaceutical companies account for about 60% of all sales. And if we look here, so we have some, this is a little bit dated, but this is as of 2001. We have some of the major brand name pharmaceutical manufacturers. And these are in billions of dollars. So, you can see Pfizer, GlaxoSmithKline, Merck, Johnson & Johnson. Now, one of the things I'll talk a little bit about in a minute is mergers, and this is outdated at this point. And so, for example, Pfizer and Wyeth merged in 2009, as well as Merck and Schering-Plough also merged. And we also have some of their major drugs over here, and you can see that with some of the major drugs, they make billions of dollars off those drugs. Now, this is the brand name. The other side of this is the generic. And so the generic pharmaceutical manufacturers, they're the ones who basically copy what the brand name manufacturers did. And so they look at it, they try to figure it out, they copy it and make a cheaper version. So they're not putting the same money into research and development. And because of that, they don't have to put as much money in. And this is why patents become important. We'll talk more about that. But it's really important to note that the reason why there is any competition with pharmaceuticals is because of these generic manufacturers. Okay. And you can see here that their revenues are significantly less than the brand name. And now again, we talked about how generics account for about half of all pharmaceuticals, but significantly lower portion of the overall sales because they aren't as expensive. Now, the pharmaceutical companies, when they get the money, they put this into a variety of different uses. So this is the breakdown of what pharmaceutical companies use the revenue they get for. Manufacturing, it doesn't take up that much. Right? The cost of the goods is actually a relatively small part of the overall sales, 30%. And what happens is that when it comes to pharmaceuticals, the initial batch of those pharmaceuticals is really the costliest, the most expensive. That's where the research and development goes in. But after that, the marginal cost of a different one gets pretty close to zero. Advertising, sales, marketing, and advertising is also a very, very big part of it. So, yes, they can have a great drug, but if nobody knows how great it is, no one's going to want to buy it. So, they spend a lot of money on this. They can do it either by television ads, kind of media ads, or by sending pharmaceutical reps to try to sell the doctor on the idea of it. Because again, the doctor's the one who makes the decision about what medication you should get. So a lot of money is spent there trying to sell the doctors on the idea. Research and development is also big, about 13%. With research and development, what that means then is, and we'll talk about this more when we talk about the development of drugs, current drugs were financed and were developed using revenue from previous drugs. And the drugs that are being sold now that have revenue coming in, that's going into research and development, that's being used to develop drugs in the future. So it's really a continuous process with that. The other thing to note is that profits are very, very big. Okay? It's a very, very high profit margin. One of the most profitable of any industry out there, not just healthcare. Now we talk about the overall cost structure. Cost structure is really defined by fixed costs. Fixed cost is huge in this market. They're putting a lot of money into research and development, a lot of money into marketing, a lot of money into other areas. And with that, these are money that they need to get the revenue coming in to kind of back them up because of those fixed costs. So what ends up happening with all of this is that most of the time, after they develop the initial batch of the medication, the additional amounts end up being very, very profitable because they don't spend much more money on that.